One of the things about the development of a persona, a detailed profile of the person or group of people that you're aiming to reach, is that there's some pros and cons. The importance of the persona is it helps organizations and staff design and deploy effective programs, outreach, and marketing strategies that align with the intended audiences that will benefit from their resources. That's why you need a persona. Anytime you create a new program that isn't reaching that existing audience. And sometimes, even if it's a new program reaching the same audience, there's going to be differences between the person's needs for this new program. So it just depends. But a lot of times, if there's no persona for that specific type of program, you need to create one. You want your staff, you want community partners, volunteers to be aware of exactly who we're trying to reach and why. We want them to understand the persona, the type of person or group of people we're aiming to serve with our program. So there's no waste of funds. There's no waste of time and resources. Everything is running smoothly and we're reaching the people that we aim to serve. And then we're feeling fulfilled in our work because there's clarity into those we're reaching. And then there's that trust factor that's being rebuilt and established. Building a persona ensures alignment across your entire team. It builds trust and rapport with the community, which I love, and it really works. I've been in healthcare and public health for over 15 years. I've been a consultant for 8. And when organizations have a persona, it really kills the stress among the team first, like truly. And then they're able to do their work more effectively. Effective use of time, money, and resources increases recruitment and retention rates in your programs. Building trust with an individual takes more than saying, we have something for you, right? I want to know who you are. I want to know the intent behind it. What's in it for me beyond the thing that you want to give me? What's in it for you? So there's some trust building behind the solution that you want to provide your community. I'm Brittany Jenkins, CEO at Jenkins Public Health Consulting. We help health-focused organizations and businesses across the United States since 2018 build stronger programs, partnerships, and relationships with communities to improve community health outcomes and access to resources. We also help current and aspiring public health professionals land mid and senior level jobs in healthcare or public health. They get competitive skills, tools, and support needed. We've had a very high success rate in the accelerator. Always so proud of people who go through that public health mentor program within 60 days so that they can land a job or a raise or whatever their goals are. When I was working for government agencies, I actually had the opportunity to serve my own community, the communities that I was raised in. And it uncovered a lot of truths about our approach. One of the things about the relationship building when it comes to any type of health organization, whether a non-government or a government agency, is about creating a profile of the type of people that you're looking to serve for that specific program. That's not to exclude anyone. A maternal health program is our example for today. This maternal health program is for those who are pregnant or planning to become pregnant. That's the person who will be best fit for this program, right? So we need to create this persona profile to make sure that we're looking for and serving the right people with these resources. That includes how we're designing our program. Where is our program based? That includes our funding and how can people access it? If they're having accessibility needs or challenges, how can we help them overcome that so that they can take advantage of this resource to improve their health so that they can live healthy, stress-free, longer lives? That's exactly why I do the work that I do. When staff of these health organizations and businesses create a persona profile of who they're aiming to reach, they will be more successful on both sides. The community will begin to trust them because they have the best interest of this person for this type of resource, for this maternal health program. A persona is really a detailed profile of who you're aiming to reach and why. It's going to say this person is a birthing person. They live in this certain zip code. This is probably where they spend their time. Let's say some of their fears are having a C-section. They could say their goal is to have a healthy pregnancy surrounded by love. Being very specific in this persona helps you reach your intended audience, and that saves the health organization time, money, and resources. If you want to create your own persona for your health organization, or even if you're a business owner, HubSpot has a great tool. It is free, and you put in all those parameters, and then it will give you your ideal persona. Some of them call it a buyer's persona, client persona, patient persona. I don't think that word is really widely used in the healthcare and public health space, When your health organization spends money in a way that isn't productive or makes sense, funding agencies see that. It isn't just about grants. There's government grants and non-government grants. But then you have sponsors, in-kind donations and cash donations. People in those different categories can see those things. And that is how organizations lose funding.